welcome to tonight's VPIRG webinar that we are co-hosting tonight with our friends from Rights and Democracy and Vermont Legal Aid. Tonight, the topic is health insurance, and specifically the proposed health insurance rate increases that we have a deadline comment coming up on that hopefully I know a lot of VPIRG members have weighed in, a lot of Vermonters across the state have weighed in. We'll talk more about that. But before we get into details, I want to welcome our two additional panelists and give them a chance to introduce themselves. I also didn't introduce myself. Zach Tomanelli, Communications and Engagement Director with VPIRG. And today we are joined by Michael Fisher and Dan Fingus. So why don't we just go around the horn, and Mike, why don't you introduce yourself first and let the folks watching out there know who you are and what you do.
Good evening. It's good to be here. So I am the state healthcare advocate, which is, I have to say, a pretty good position. It's my position in my office, the Office of the Healthcare Advocate, is defined in state statute to be a support for Vermonters on a couple different levels to help people get the care they need in the world of healthcare. And so I'll just say a sentence or two more about the role I play. We run a helpline that's available to all Vermonters. There's no income eligibility for it. And so if anybody listening or if you know anybody who's having some kind of an access to care problem, look up Healthcare Advocate, or the legal aid page is vtlawhelp.org, or you can call us at 800-917-7787. I've got a staff of incredible advocates who are activist-like in their attempt to get people the care they need. The other role I have is as a public advocate, as a consumer advocate in front of the Green Mountain Care Board and the legislature whenever they're making decisions that affect Vermonters' access to care. And that's primarily the role that I'm in for tonight's discussion.
Excellent, and we'll be diving into more about what that advocacy's looked like, over the years, and particularly this year with the current rate review process. But first, let's hear more from Dan.
Thanks, Zach. I'm Dan Fingus. I'm the Vermont State Organizing Director for Rights and Democracy. Rights and Democracy is a 5-year-old social justice organization that's member-based. We have members and chapters all across Vermont, and we're really happy to talk about the need for affordable health care. It's one of the founding issues that we started working on 5 years ago. Thanks for having me.
Well, thanks for joining us, and playing an invaluable role, making sure that Vermonters can make their voice heard in this discussion and be a part of this. So Mike, I think you're sort of best positioned to provide those of us listening with a little bit of background about the whole rate review process going before the board, where that comes from, how that's historically played out, and specifically this year's proposed rate increases. Yeah. So let us know a little bit more about that.
So back in 2011, the same bill, people often refer to Act 48, this is the bill that was supposed to frame up a single-payer, publicly financed healthcare system for Vermont, also created the Green Mountain Care Board, and much of this rate review process happened that year and the year after. And Vermont has an unusual rate review process. In many states, an insurance commissioner may gather information and hire actuaries and discuss it, but we have a particularly transparent and open process where there's a public hearings and there's this ability for Vermonters to weigh in. The other thing that makes us very different from really, I think, pretty much every other state is that the legislature asked the Green Mountain Care Board to weigh competing interests. There's 7, I think, different factors that the Green Mountain Care Board has to consider, but I'll just mention 2, and that is to weigh both affordability, consumer affordability, and insurer solvency in their decision about how much to allow health insurance companies to raise rates.
And in terms of how that process plays out on a yearly basis, we have two insurers that go before the board. Maybe take us through the timeline of when those proposals come in, and then how the public is able to sort of participate in that process.
So this is an incredibly long, drawn-out process that really started in January with the definition of the plans, and there's a process for that. And I won't go through every step, but in the last 2 days, Monday and Tuesday of this week, was the actual hearings. And those were long, drawn-out hearings with many expert witnesses, many actuaries and insurance executives, and my team arguing, and the board arguing about lots of details of the case. I'm not going to go into the details of any of it. I don't think it's exactly right for me to sort of relitigate any details of the case. I'm going to try and stay on a bit of a higher level of the process. The board had a public hearing last night that many people participated in, but they also have this ability for people to publicly comment. I think at this moment, last time I checked, we were at something like 830 public comments. The public comment period ends tomorrow, Thursday, at 11:59. So we really have a day and a little bit. And I'm going to just go ahead and issue a goal. I'm going to be optimistic. Wow, wouldn't it be cool if we could get over 1,000? So anybody who's listening, help us out. We're going to give information about how people can comment. Zach, do you have the links up on the page? Or
I muted myself there. We will post the links for people to post in the comments on Facebook where this is airing. So we'll throw that up in the comments afterwards. So hang around. If you're watching this, we'll put that up at the end. Links for people to send out comments. And we'll also.
And then I'll also just say that the board has it's something like 60 days or 90 days from when the rates were filed. That I believe is August 6th. This year. So that's generally the timeline.
So that's really helpful, and we will circle back, at the end on again how people can get involved, which is really sort of the most important part here. But I do want to bring Dan in, but before I do that, I do want to I think people watching, some people may know, some people may not know, get down to the brass tacks. What are the numbers? What are the proposed rate increases that are being discussed this year?
So first off, it's important to mention that this is for the plans available through Vermont Health Connect and for the small group market. So if you get your insurance through you have a small employer or that you get your insurance through, or your partner, or you get it directly from Vermont Health Connect, these are rates that affect you. Blue Cross filed for, I think it was a 6.3% rate increase, and MVP filed for, I think it was a 7.3%. And I say I think because honestly, those numbers have come down about a point each. It's in the something like 5.5 and 6.5. I'm being general here because some of those numbers do change in some of these arguments. But generally, that's about what the average rate increase that was requested by the insurance carriers. And then if I could also just say, the people who have commented, I think Dan's going to talk more about this, but the people who have commented, I think what's useful is for people to say, hey, how would this kind of a rate increase impact you and your family? I think that's what we're after. If there's anybody out there that wants to say, hey, this is great, I can afford it, and I think that the carriers should increase the rates, then go ahead and say that. If on the other hand, your experience is that you're struggling, or if you're a small business person and you're struggling to figure out how to continue to offer insurance to your employees, just consider what a 5.5 or a 6.5% rate increase would do to you.
Absolutely. So let's talk about that. So Dan, I mean, maybe if you could put this in context a little bit in terms of affordability, access for Vermonters, how this compares to wage growth, you know, when we talk about, 6%, 7% increase, what does that mean?
Well, I mean, it's probably no surprise that Vermont has not seen 6 or 7% wage growth in last year or the last few years. I think really importantly, last year it was a double-digit increase. The Green Mountain Care Board approved double-digit increases for both MVP and Blue Cross Blue Shield. The latest numbers before that were that wages went up 2.8% in 2018. And for the lowest folks making the lowest wages, minimum wage only went up 1%, 1.8%. Between 2018 to 2019. It's interesting when you think about the issues together. We spent over 3 years, tons of hours, activist hours, trying to get a raise in the minimum wage. And so we're raising the minimum wage to $12.55 an hour over the course of 3 years, which is about a 13, 14% wage increase, which averages out to maybe a 4.5% wage increase for minimum wage earners. And there was a double-digit increase in their healthcare costs last year. There's going to be a 5, 6, 7%, whatever they end up with. We can't even know because last year one of the insurers, I believe it was MVP, only asked for an 8% raise and they got a double-digit raise. So Green Mountain Care Board can give them more than they want because they've done it before. So it's obviously not affordable. The idea of wage increases, minimum wage increase, is so controversial in this state that it was vetoed twice by Governor Scott, and it took over 3 years to be done. And regularly every year, healthcare costs are going up, and it's the same legislators who decide who sits on the Green Mountain Care Board. Phil Scott has a role in it, and so it's really uneven. It's really unbalanced the amount folks are prospering in their wages and how much they have to pay just to keep healthcare.
So, Michael mentioned, those personal stories. I mean, I think Dan hit the nail on the head. Broadly speaking, the math isn't adding up, right? In terms of affordability for Vermonters, wage increases are not keeping up with even close to what we're talking about here. I want to loop back to Dan to hear a little bit about the public input that's been coming in through Rights and Democracy, and I'm happy. I have a couple examples that I'll share from some VPIRG members as well. But Michael, I mean, you were listening to the public input on the hearing last night. I think you mentioned we've had hundreds of comments submitted this year. Just generally, the flavor of the comments that are coming in. Speaking from what I've seen from VPIRG members supporting, there doesn't seem to be a whole lot of people weighing in to say, hey, yeah, these increases sound good to us. They're right on target for what we want. So I kick it to you to hear just a little bit about what the public input has looked like so far.
Well, I think let me just speak sort of on the emotional level. Vermonters are scared, and that is about the virus. It's also about their economic plight, which is impacted by the virus. Many Vermonters are really worried about how they're going to make it. And I say Vermonters, I mean Vermont families, and I mean Vermont businesses. And so that comes out with some real strong expression of upset and challenge to the board. I think many people have commented recently about how hard it's been to get healthcare in the last couple of months. And this perception of this experience that they've been paying their premiums, struggling to pay their premiums and not able to get care. And that doesn't add up for a consumer. And I think, so that's a major theme that a lot of people said. And I think the other major theme that people said was, it's just, I think, like you said, Zach and Dan both, it's just too expensive. It just doesn't work in my family's budget. And it, taken together, the comments, I've read through, I can't say I've read all 830 something. I've read a lot of them. It's a powerful storytelling project. It's a powerful insight into just what's going on in Vermont families today.
I couldn't agree more. And Dan, I'm wondering if you'd be willing to weigh in a little bit on what that story looks like, particularly the comments coming from Rights and Democracy members and what you're hearing and seeing.
Yeah, I mean, I think it's a lot like what Mike has been saying. I mean, we're actually seeing a lot of folks that are identifying themselves as self-employed, so they're having to figure out how to get health insurance, themselves. One of our members named Michelle that lives in Essex, you know, really talked about how as a small business owner, she was just really able to start affording health insurance and for herself, and was just kind of getting into it. And then COVID happened, and that obviously causes issues, and now they're talking about raising the rates even more, and so it's a really tenuous situation. We're seeing a lot of that. We're obviously seeing a lot of anger. We're seeing a lot of folks that just don't understand how we're in this pandemic, and we're in this place where we're in an emergency. Our lives are in an emergency. Our economy's in an emergency, and we're just kind of rolling through this regular rate review process where while everyone else is figuring out ways to downsize and to cut and to trim budgets, the insurance companies are still able to ask for 5% and 6% raises. And so I think that's a lot of what we're seeing. It is surprising to see in this new economy how many people are self-employed, how many people are doing things, and so then they're even in more of a precarious position in this pandemic because of it.
Absolutely. I would say, reading over the comments that VPIRG members submitted, those themes have come up as well. The pandemic has obviously played a significant role in kind of how people are viewing this. I mean, Dan mentioned it. This was unaffordable before this pandemic, but this is only, obviously exacerbated that. Seeing a lot of comments of people either losing an income in their household if they were a two-family household because of people losing jobs, people taking pay cuts. I mean, we talk about wages not keeping up with increases, but for people who have been able to maintain a job, maybe not lose a job in the pandemic, but actually making less money, I've seen that in the comments. So that's fairly common, and again exacerbated this year. And I looked and I pulled out just two comments that stood out to me. And these people gave permission, to share this. I won't attach any names to this, so just anonymous. But these are, two comments that were submitted through the VPIRG's portal, and just I'll actually read them in their entirety because I think it gives a flavor of what people are dealing with. But here's one. I don't know how I can afford it. I made decent money at my job, but with my older daughter having significant special needs, it forced my wife to become a full-time mom caregiver. So we have a family of 4 living on one income. I already work 50 to 60 hours a week and more at my 2 jobs just to pay bills. We don't get to go on nice vacations because we can't afford to. How much more can you take from the poor? And then here's another one that I think speaks to particularly younger people in Vermont. I recently turned 26 and was therefore kicked off of my parents' health insurance. I was pleased to be able to sign up for an affordable healthcare plan through Vermont Health Connect. Doing so has allowed me to continue doing a job that I love, a job which does not provide me health insurance. If insurance rates are hiked, I'd have to reevaluate that decision. So, these are
really sad. Really sad to hear. You can hear the people struggling. And this is what we're hearing all across Vermont.
So,
Can I actually ask Mike a question?
Go
Mike,
for it.
We have heard our members saying, this is a pandemic, we're in an emergency situation. Don't these health insurance companies have rainy day funds, emergency funds? If this isn't the time to deploy that kind of mechanism rather than a rate increase, like when is?
Yeah, I think good question. And that's something that my team argued over the last couple of days. I think one theme that I've heard a lot of, hey, Vermont has done well. We need to pat ourselves on the back. We should pat ourselves on the back. We have done extraordinarily well at avoiding the kind of community spread that we're seeing around the country, and that has taken real sacrifice. And that is Vermonters looking out for each other, wearing masks, avoiding physical contact, staying home from work, and not going to the doctor for non-COVID related care. There's been real sacrifice on Vermont families' part and on Vermont small businesses' part. So now is the time, to have Vermonters back. And you're right, Dan. By state law, we require insurance companies to have a surplus reserve, a pile of money that's there for situations that are, to make sure the insurance company can keep paying claims. For years, we've asked the question, why do we have a reserve? And the answer has been, what if we have a pandemic? So here we are.
And they generously went from 7-something% down to 6.5%. That was their response to the pandemic.
Honestly, that was the response to actuarial arguments in much more detail. But it's a good question, Dan.
So I'd like to, talk about a little bit, what does the process look like from here? And not going to end on that, because I want to foreshadow for people, one thing that I think is coming through to me, and, we go through this year after year. This is not, sustainable. So I think there's bigger questions here than, directly this particular rate increase, but 800 plus Vermonters have weighed in. We're going to try and get to 1,000 people weighing in. Mike, what can people expect, from this point forward? I think you mentioned earlier there's a 60-day window. So, people have certainly made their opinions heard. What do we see happening from here?
Well, like I say, and like you just said, we have just a few more, a day and a half, day and a bit for people to make comments, and then the board's going to deliberate and make a decision. And I will also say, I think it's really important for people to comment before the end of the day tomorrow, but there's really no end to public comment periods. I mean, the board takes public comments all the time. And so whenever somebody feels the need to communicate about what's happening in their lives around access to healthcare, I think the board needs to hear from us. And then the board is going to make a decision, like I say, by August 6th. It must be 90 days, by the way, Zach. Couldn't have possibly do this in 60 days. And that will then translate into the rates that will be available in next year's open enrollment period.
Great.
Can I just say how crazy it is that they spend from January to October every year just figuring out how much more money they're going to charge us? And not whether it should go up or down, but how much more.
I think that is just eye-opening, and yeah, I mean, that's totally right. In terms of, if there's anybody listening out there that's saying well, you're asking us to get involved, and it seems like the rates are going to go up no matter what. I hear you on that. I will note, though, that there is value in people making their voice heard. One, in terms of continuing to kind of get the story out here and get this narrative. And, while it's just absurd that the rates are going up, at all in this context, and Dan's highlighted that, public comment has at least had the value of in other years, not every single year, causing the board to reconsider and at least cut these comments. And Mike, I think you could maybe talk to that. I mean, again, it's a little bit unpredictable, and the board takes they're weighing a lot of different things here, and it could come out many ways. Dan, I think, highlighted that they actually gave a higher increase than was requested last year. But in terms of, the value of people weighing in and why it's important, it does make a difference, or it has the ability to make a difference.
Yeah, I think I've come to believe that these projects of getting public comments for the Green Mountain Care Board, or coming on the show today, it is important for a bigger reason than just these rates. Yeah, I don't think the rate should go up. I've argued that long and hard for many, many hours this week. But I think that we have a bigger project in front of us. And, we're in the context of this rate question, but we're also in the context of what do we need to do for our healthcare system? And there's nothing like personal stories. In fact, probably most all change happens at its core because of the personal stories, because of what's happening in people's lives. And so speaking out and having an opportunity to be heard is a bigger act than just related to whether Blue Cross gets 5.5% or 3% or whatever the board gives them at the end of the day. think it's important to be heard.
I think that's really well said. And Dan, I wonder if you want to add on to that or speak to that concept. There's the rate increase, but the larger question here and how this factors into that.
Yeah, no, I think that's definitely right. I think we have 28 hours, or 28 and a half hours to get comments in. Folks should do that. I think what's great about the system we have for bringing in comments now, and I dropped the link to our public comment link into the Facebook page, so folks can see that now, is it gives options for folks to share their story, and so that way Rights and Democracy and other partners can help share that, and also just to stay connected with Rights and Democracy, because the rate review is just one piece. We also have to get proactive with healthcare policy, with making healthcare an important issue in the 2020 election in Vermont. There's so much that we can be doing, and if we show that we can have 1,000 people commenting on healthcare for this rate review process, which is a little hidden and a little long, a little arcane, but really important. Like, think about what we could do with 1,000 people's voices at the State House and other places to make sure that we are getting the kinds of reforms we need to make a more affordable system, whether it's prescription drugs, whether it's just overall accessibility, whether it's all the way down the path to the universal health care that we need in Vermont and the whole country. So this is just one way you can get involved. But it's a really important way we can get involved in the next 28 hours. And then we just need to stay involved all the way into 2021.
And I'll also say, the members of the Green Mountain Care Board are 5 human beings. It's easy to characterize them as, as sort of the bad guys or something like that. From my perspective, they're not. They're 5 human beings that are making the decisions as best they know how. And they need your help. And, I'm not going to pretend for a minute that if we cross $1,000, we're going to get a 0% rate increase. There's nothing simple in this world, but it helps.
And, I think that's a great point to make. And to Dan's point about, this being a step to people getting more involved and being part of, organizing going forward. I'll note, from VPIRG's perspective, Dan, I think you described it as a little bit of an arcane process. We encourage, our members to weigh in every single year. And despite it being an arcane sort of process, this is something that brings out quite often the most passion among people, and people are eager to get involved. And I think because it hits so close to home. We talked about some of these personal stories and exactly how it's impacting people. And I don't know if Rights and Democracy has had sort of similar experience, but this certainly elicits passion from people. And making a comment, getting involved, and then carrying that through to additional organizing and participation in the debate about healthcare and how we fix it in this state, in this country, seems really important.
And Zach, we have questions in front of us right now. How are we going to pay for broad-based testing? Should we have broad-based testing across the state? Should everyone who wants a test be able to get a test? Boy, I hope that we're going to be facing the challenge of how we're going to pay for a vaccine next year. I'm hopeful that we're going to get to that. And, are we going to pay for it with our, third-party insurance companies? Or is there a public financing model that makes sense for how we do such an important public health effort as making sure everyone gets tested that wants to get tested and everyone has a vaccine available to them? So comment today so that you can get engaged, and you can get engaged in the questions that are coming right on the tail of this one.
That's such a good point. We're coming up at 7:30, so I think this is kind of a good point to wrap, but I will leave it to each of you if you want to put in a final word or two. So Dan, any final word you want to provide to anybody listening or watching later?
No, I'll just say, testify, get active, get involved, reach out to VPIRG, reach out to Rights and Democracy. Even if you've already done testimony and you didn't, do it right through the link that we use, you can reach out to us through our Facebook page, through our website. We're happy to help you find other folks who are willing to get active and get involved so we can make a difference. And I'm sure Mike's going to relay all of the details of how to work with the healthcare advocate, but I know we've had members who've worked with the healthcare advocate's office and really been helped. And so if you're having your own healthcare insurance issues or really need to talk to someone with some expertise, I definitely recommend folks talking to Mike's office, healthcare advocate.
Yeah, we can't help everyone. I mean, we're not successful with everyone. Some people call us and say, I just can't afford it. And you know, my poor advocate has to say, yeah, that sucks. But there's also times when we have an idea up our sleeve, something we can suggest, or a way around the bureaucracy to help people get the care they need. So look us up, 917-7787, by the way, 800-917-7787 is our phone number. If you or your loved one is having any kind of challenge getting the care you need. And always feel free to be in touch with us through our various, you know, our website and our Facebook page to be engaged in this kind of work as well.
Well, thank both of you so much for joining today. I found this really useful. I hope the folks watching out there also found this really useful. You know, I'll leave a last thing is comment if you haven't. Please do weigh in, and especially if you have personal stories to share. Those are really the most powerful. So thanks to both of you, you know, for joining us and for the work that you both do and are doing. So I really appreciate it.
Thank you, Zach. Thank you, Dan.
Thanks, Mike.